Hello, I am Dr. Payal Chitranshi, ENT surgeon from Restore Hospitals at Road number 1, Kukatpalli. I will be discussing regarding allergic rhinitis. What is allergic rhinitis? Well, allergic rhinitis is an allergic reaction of the body towards any environmental or food molecules which the immune system of our body considers as foreign material and starts responding by producing some chemicals within the body which gives rise to various symptoms. Allergic rhinitis is very common. More than 10 million people in India alone are affected. But many a times allergic rhinitis is self-limiting. It though can take prolonged period of time to gradually reduce. Sometimes it might not recover but increase in severity and frequency. So we need to know all about allergic rhinitis. Allergic rhinitis can be of two types, either seasonal, which happens during the change of weather, especially during the time when pollen grains are in the atmosphere, or it can be perennial, where the symptoms occur throughout the year. What happens is when the body is exposed to a molecule which is foreign to it. Most of them include pollen grains, cockroaches or mite, house dust mite, or animal excreta and saliva. The body will produce chemicals. This leads to running nose, nasal stuffiness, itching and watering, as well as redness of the eyes. It can lead to sore throat. In very severe forms, it can also lead to asthma and eczema. What is the primary treatment of allergic rhinitis? Well, for allergic rhinitis, we all know there are antihistamines which are available over the counter. These antihistamines lead to suppression of symptoms of allergic rhinitis like the itching or running nose or nasal stuffiness, but they don't actually control the sequence of events or the chemical production which happens due to allergic rhinitis. Also, there are some leukotriene inhibitors. Leukotrienes are chemicals which are produced in the body in response to an allergen. These leukotriene inhibitors, most common of which is montelukast, can actually inhibit a step of the cascade of reactions which leads to chemical production and is quite effective. Then we can use nasal decongestants which help in reducing the swelling in the nose and improving the airway and helping us to breathe. But a word of caution here. Use of nasal decongestants bought over the counter for more than 5 days can actually lead to increased swelling in the nose and dependence on the decongestant. It would be advisable to avoid such medicines for more than 5 days. We also use steroids which are anti-inflammatory and anti-allergic, which help in reducing the symptoms of allergy. These steroids can either be in the form of nasal sprays or oral tablets depending upon the severity of the symptoms. A better way to avoid allergic rhinitis would be to take precautions like avoiding exposure to dust or the food substance which are known to cause the symptoms. Also, avoiding unnecessary exposure to change in weather or climatic conditions. It can also be taken care of by trying to improve our immunity by improved diet and adequate exposure to sunlight, so that there is adequate vitamin D in our body which acts as an immunomodulator. In case of a vitamin D deficiency, we need to supplement the vitamin D so that our immunity levels are proper to avoid any kind of allergy. Here again, if the symptoms are not reducing, if the symptoms are severe, or if there are complications like nasal polyps or sinus infections or ear infections, then we need to approach our doctor, who will do a battery of tests after taking a thorough history. He would like to evaluate your IgE levels or the immunoglobulin E, which are raised in allergy, and will tell us the severity of allergy. Also, a eosinophil count is required to know whether there are any worms in the blood, and then a CT scan of the sinuses if some kind of complication due to allergy is suspected. Based on the tests, the doctor will advise you regarding any further form of treatment which is required. We at Restore Hospital are taking care of all allergic rhinitis patients. We give long-term treatment. We give certain recommendations regarding what to avoid, what to eat, and also adequate treatment, both surgical as well as medical, as per the patient requirements. Thank you.
And specifically for those patients who don't have much amount of mustache hairs or beard hairs, or in those patients who have scarring alopecias. We have many burn patients whom we did transplants on those beard areas, and we got excellent results for them. But what is the reason that you go for these mustache and beard transplants?